Good morning. I'm Pratima Shrestha, a student nurse from Western Sydney University, and here is my student ID. Today I'll be presenting a case study on breast cancer, focusing on Amara's condition and the nursing care provided post-surgery. Breast cancer is a disease where abnormal cells grow uncontrollably in the breast tissue. It usually starts in the breast ducts and can spread to nearby tissues if not treated early. Moving on to second slide, I will be talking about pathophysiology of breast cancer. Amara has been diagnosed with stage 3 invasive ductal carcinoma, which is the most common type of breast cancer. IDC occurs when abnormal cells grow in the lining of the breast ducts and spread into surrounding tissue. As the tumor grows, cancer cells can spread through the bloodstream and lymphatic system to nearby lymph nodes and surrounding breast tissue. In Amara's case, biopsy results confirm the spread of cancer cells in the axillary lymph node and part of chest wall, which is an indication of advanced stage cancer. Breast cancer develops when mutations in breast cells impair the normal function of the cells, leading to uncontrolled cell growth and targeting of the surrounding tissue. In this case, BRCA1 gene mutation was detected during genetic testing. This gene is responsible for repairing DNA and preventing abnormal cell growth. However, when this gene is mutated and fails to function properly, the damaged cells can multiply and become malignant. So now I would be talking about risk factor associated with Amara's condition. There are several risk factors are highlighted in this case study. Firstly, being a female is a major risk factor, and also her age increased further breast cancer risks. Secondly, the confirmed BRCA1 mutation significantly increased her susceptibility to developing abnormal growth of cells leading to cancer. Even though she does not have any family history, BRCA1 mutation can develop without having a family history background. In addition, her symptoms of unusual nipple discharge and painless breast lump on her right breast are common symptoms of invasive breast cancer. Okay. Now, I will be talking about pharmacological management of postoperative pain. Due to the spread of cancer to the axillary lymph node and chest wall, Amara required neoadjuvant chemotherapy before undergoing a modified radical mastectomy to reduce the size of tumor and control the spread of cancer. After surgery, she is experiencing postoperative pain along with pins and needle sensations around the axillary region. This discomfort is caused by nerve irritation and inflammation after removing breast tissue and lymph node. And effective pain management is important for the recovery process following a mastectomy. One of the important pharmacological interventions include administration of analgesics such as ibuprofen, paracetamol, antiemetics, and opioids such as morphine, oxycodone. So strong opioids and opiate analgesics are used for moderate to severe pain, while paracetamol and ibuprofen help manage mild to moderate pain and inflammation, and antiemetics to manage nausea and vomiting. It is stated that right analgesia needs to be administered to mastectomy patient to help early mobilization, improve respiratory function, and for better recovery. As a nurse, it is also crucial to closely monitor for adverse side effects such as drowsiness, nausea, and respiratory depression to ensure medication is safe to use and escalate concern to the doctor. Okay, next slide. I'll be talking about non-pharmacological pain management. Along with medications, non-pharmacological nursing intervention are also important. Supporting Amara's affected arm with pillows can reduce pressure and improve comfort. Gentle arm movements and breathing exercise can improve circulation, reduce stiffness, and promote lymphatic drainage. This intervention can also help reduce the risk of lymphoedema. Maintaining a healthy diet with enough protein, fluids, fiber, and nutrients is also important to support healing and strengthen the immune system. Non-pharmacological treatments can be used to help with pain management. Next, I will be talking post-operative wound care management. After a mastectomy, Amara has two wounds drains in institute to remove excess fluid and prevent fluid accumulation. She requires proper wound and drain management because surgical wounds and drains increase the risk of infection, delay healing, and cause other complications if not managed properly. One fundamental nursing intervention is routine assessment of wound dressing and drainings using aseptic non-touch technique to prevent direct contact with the wound site and reduce the risk of infection. Nurses should monitor the early signs of infection, which includes redness, odor, swelling, bleeding, warmth, increased pain, or abnormal wound discharge. Okay. Another nursing intervention is to ensure the drains are working properly and draining effectively. It is important to check each drain for output volume, patency, and the type of fluid, such as color, to identify complications early. For Amara, it is important because excision of lymph node has disrupted normal lymphatic drainage and increased the risk of lymphoedema. The drains must be kept clean and unblocked to allow continuous drainage of blood and lymphatic fluid. For example, if the fluid accumulates around the surgical sites, it may cause problems such as formation of seroma that can slow the healing process and cause pain. This applies very well in Amara's case because she had removal of lymph nodes, which makes her prone to swelling and fluid-related complications. If the drains are not managed properly, then the drains could make her healing process longer and more prone to an infection. Therefore, regular wound assessment and proper management of drains are important for promoting wound healing, preventing complications, and supporting Amara's safe recovery. Before discharge, patient education is important for Amara to make her feel confident to safely manage her recovery at home and recognize complications early. One of the important aspects of Amara's recovery is care of her wound and surgical drains. As she has two surgical drains, which should stay inserted until next follow-up or 1 to 2 weeks after surgery. She should be educated on keeping the wound site clean and dry, safely managing the drains by keeping intact and emptying several times a day, monitoring signs of infection such as redness, fever, abnormal wound discharge, pain, and seeking medical help when needed. Another important part of her care is to minimize her risk of developing lymphoedema. The removal of the lymph node increases her risk of arm swelling, so nurses should provide education on avoiding heavy lifting, injuries, avoiding tight clothing, and blood pressure management on the affected arm. Nurses should also encourage gentle exercise and slow mobilization as it helps to improve lymphatic flow and maintain mobility. For Amara, psychological well-being is also important and should not be neglected. Cancer treatments and major surgeries can be emotionally challenging. It can also affect body image and reduce coping ability. Referring Amara to a breast care nurse and other support services such as Breast Cancer Network Australia and Beyond Blue can provide emotional support, education, reassurance, and coping strategies. Lastly, multidisciplinary care by a team of medical professionals, physiotherapists, and support services is crucial for Amara's recovery. Physiotherapists can assist with mobility exercises, while oncology team continue monitoring treatment and recovery. This is a holistic approach to her care, which provides all the care she needs both physically and emotionally. For further support, I have provided contact details of Breast Cancer Network Australia and Cancer Council. And here are my references. Here you go. Thank you. This is the end of my presentation.